Thank you very much. We will move on to Part A of our agenda. We'll refer back to Part A. Item 4300, Department of Developmental Services. Let me tell you how we're going to structure public comment. Help me help you. I'm just helping you out here. So this is the way we're going to do it. Following the community service federal overtime change issue on page 3, there'll be 3 opportunities under this section for public comment. Following the community service federal overtime change issues, which is on page 3 of the agenda, that'll be our first public comment time. The second will be at the end of the developmental centers issues, items 1 through 13, which starts on page 5. That'll be your second opportunity. And the third will be following the Health and Human Services Agency Office of Law Enforcement support on page 25. So those of you who aren't seasoned advocates, that means if you have any issues that come up between items 1 through 13, you wait for that second public comment time. Got it? We think that's the most efficient way of handling public comment. Are there any questions, or is anyone confused by what I just suggested? Excellent. Thank you very much. We will get started by hearing from our first panel. Thank you all for coming to the table. John Doyle, Chief Deputy Director, DDS, Tom Hines, Executive Director, East Bay Innovations, Sean Martin from the LAO's office. Thank you very much. You can go ahead and get started.
Hi, I'm Tom Hines. I'm the Executive Director of a nonprofit called East Bay Innovations. We've been providing supported living services to folks with developmental disabilities since 1994. I wanted to just lay out the interplay between in-home support services funding as a generic service and supported living funding, which is funded through the regional center system. Since my experience with supported living in 1994, it was my understanding that providers of supported living services were required to help consumers receiving supported living services to access IHSS as a generic service. So we would help people go through the assessment with the county IHSS worker. The consumer that we would serve would be allotted hours. When we knew the number of hours that the consumer was allotted per month to receive IHSS, then the regional center would fund services that the person needed to live on their own around those hours, around those IHSS hours. So basically, to make the funding for the services that the person needed come together, you needed to fully access the IHSS hours to pay for their staff to make the regional center dollars work. When we started in 1994, we realized quickly that the IHSS system, payroll system, their procedures for onboarding workers and assigning hours to workers were extremely cumbersome. You know, it takes an average of 60 days to onboard an IHSS worker through the county. In the world of supported living services, when you're serving people who oftentimes need 24-hour support and who have significant cognitive disabilities, you're really doing all you can to help workers get through the IHSS process, get approved, so that they can start billing hours under IHSS. Otherwise, your budget as a supported living provider for services for that consumer does not work. You're already in a budget deficit situation. So historically, supported living providers have done a lot to help workers and consumers access that IHSS system. For no other reason than financially, if you don't do that, then the funding for supported living does not work. So you fast forward and to the recent federal overtime change that was about to be implemented, and trying to figure out how that would work was really alarming, because already the two systems of IHSS and supported living and regional center funding do not work well together. So we, looking at these potential overtime implications, understood through researching Department of Labor regulations that because we assist consumers to manage and access their IHSS, because we schedule IHSS workers, because we help to onboard IHSS workers, because we help consumers manage that piece so much, we were likely to be considered as joint employers with IHSS when overtime happens. So what that would mean to us is if one of our workers worked an hour in IHSS for a consumer, that hour would need to be counted towards the 40-hour threshold per week for overtime, just as a regional center funded hour would be counted. So all hours would need to be counted towards the overtime. And us, the employer, the supported living agency, would need to be on the hook for paying that overtime. Now, we very much support anything that will pay direct service workers more, but we have to be funded to be able to pull that off. Our estimates of what was allotted in the governor's budget last year for this overtime change would have been about half of what was really needed to cover the cost. So we were really extremely concerned that we were not going to have enough funding. Seeing ourselves as joint employers, gave us a big deficit. So that's kind of where we are. If it happens again, then we'll be in a similar situation. I will say one thing about IHS. Some people say, well, why don't you hire more workers? Unfortunately, in our experience, and we're in the East Bay, it's a hot job market, we could not find enough workers so that each worker would be limited to 40 hours a week. We just couldn't do that. There aren't enough workers in the pool. Secondly, people say, well, why doesn't IHSS cover the overtime? Well, as you can see, last year when IHSS rolled out some of their procedures for workers being approved for overtime, some of it is quite a lengthy process where workers really wouldn't get a check right away. And we already have a situation with IHSS where it's a pretty rigid payroll procedure. And we already have many occasions where workers don't get paid on time. So it would just be adding that complexity on a system that already isn't very smooth.
Thank you. Colleagues, I suggest that we wait and hold questions for the end of the panel, if that works for you. Excellent. Next, we'll hear from Mr. Martin from the LEO's office.
Sean Martin with the Legislative Analyst's Office. As noted in the agenda, the Federal Department of Labor appeal is being heard today. So we think that the staff recommendation to hold this item open until we have a better understanding of how that court case is going to turn out makes sense. We also note that in the current year budget, there's money appropriated and for this purpose of implementing this, and if the legislature wants to make sure that those funds are not spent for other purposes, that they could enact legislation to do so.
We'll move now on to Department of Developmental Services, and you've got several questions in the agenda. I hope that you'll follow. Your testimony will include answers to all of them.
Absolutely.
Thank you.
Thank you, Madam Chair, members. Before I begin my testimony, I would like to send the regrets of our director, Santee Rogers. He is home ill today, but you can be assured that he's watching on Cal Channel. So,
we'll wave at him. Thank you. Hope he feels better.
To address your first question regarding the dual employer issue, as Mr. Hines said, under federal labor law, there are a number of tests to determine whether a dual employer relationship exists. Do you schedule worker hours? Do you manage their time? Do you have control over their wages? Do you have the ability to hire and fire? So those are some of the issues that have to be considered, and on a case-by-case basis, I think is typically how these things get decided, because issues that may impact one employer may not impact another. But we have heard that, in discussions with Mr. Hines as well as other supported living providers, that there are concerns in the community about the ability to hire folks. But the issue of whether a dual employment situation exists when it comes to the issue of pay, we think that from our perspective, that shouldn't be a consideration because under both federal and state law, it's prohibited to supplement IHSS wages, so that if a provider is going to provide IHSS services, they have to provide those services at the wage that is agreed to on a county-by-county basis.
Are there ways that you can control their time in terms of limiting the hours? What other kind of control mechanism do you have, if any?
Well, as far as in-home support services, those are, anything that's required is outlined in the individual's individual program plan. But our ability to control IHSS is, there are caps that are put on it, but what our concern is that, this relationship, like I said, we don't, as long as a provider isn't supplementing IHSS wages. For example, if you have a provider that has hired someone to provide IHSS services, and let's say the county pays $13 an hour, and for supported living, let's say they're paying the individual $15. So if a provider is supplementing those wages to make sure that the individual is always receiving $15 an hour, then, we see a problem there. And then to move to your next question regarding the funding that was put in the current year, understand the committee's concern, and we issued a letter in March 2015, and we deallocated $17 million in funding from the regional center contracts, and we are keeping that money set aside. And then the final question on whether we've considered turning all attendance services over to supported living providers. Well, we do understand there is a close link between these two types of services, but the administration hasn't considered turning all IHSS and supported living services over to supported living providers. We think that IHSS provides a cost-effective and efficient means of providing services, and as long as it's appropriate with an individual's individual program plan.
Any comment? Colleagues, any questions at this point? Senator Monning.
Just a quick clarification. You shared the example of a county reimbursing at $15 an hour and a gap with a $13 an hour reimbursement. Could you just amplify in that example a little bit? I'm not quite sure I understand the gap and who's responsible. You said you saw it as a problem if the provider closes that gap, but that's not a problem for the provider of services, presumably.
Oh, correct. No, I understand that.
Right.
And yes, and I'm sorry to clarify a little bit, Mr. Monning. What I was referring to is if the county's paying $13 an hour for IHSS services and a supported living provider is paying $15 an hour, what we're saying is when they do supplement that wage, that brings them, it makes them responsible for setting wages. And what our point is that could make them, it could be one of the tests that moves them towards a dual employer relationship. But again, we're concerned that it's not consistent with federal and state law.
Great, so that helps. So the challenge is how that could put them into a category of a dual employer if they're bridging that gap.
That's correct.
Thank you.
We'll open it up for public testimony. This is opportunity one, and with two more to follow. We'll let folks queue up, and we'll ask you to keep your testimony under 2 minutes.
Okay, I want to be really clear. It's called the Economic Realities Test.
Identify yourself first,
Oh, I'm
please.
so sorry.
Yes.
I'm really frustrated on the supplementing part. My name is Jackie Dillard-Foss. I'm with the California Supported Living Network. I spent most of 2014 talking to Department of Labor on the federal side in regards to the FLSA. We're talking about the Economic Realities Test, which says we have the ability to hire and fire. We have the ability to set schedule, and we have the ability to assist the person in supervision, and we have the ability to set wages. There is no supplementing. Supplementing is illegal in the Medicare field. What we do is the person is paid IHSS wages at $10.50. Our agency pays the wage that we set. The conversation on joint employment is after the 40th hour, who pays the overtime on the 41st hour? We do not, it is illegal since the beginning of time to supplement. You can't supplement a doctor's wages. You don't supplement employee wages. That's a very basic tenet. We do set schedule. And by regulation, in the supported living regulation, we are mandated to access IHSS services. So over this one-year conversation with Department of Labor and under joint employment, we had tried to find any way. We met with DDS several times as well, and we gave them the large book of everything we learned from Department of Labor, talking to Department of Justice, to the Olmsted attorneys. This is a really complex issue, and I'm getting frustrated because I feel like we as employers are going to be left on the hook for the lawsuit when we get sued. And the other set aside that I want to say about this is not only is it about the overtime, we are also for medical, dental, vacation, sick. All those things happen under joint employment. So we need to really have a much better conversation around joint employment. I appreciate Tom Hines' conversation because that's directly where it is. But there is no supplementing, no provider. We've done the survey. We've told them the law. There is no supplementing of wages. It's a very different conversation. So I'm very passionate. I hope we're clear on that one. Thank you.
Thank you very much. Next witness, please.
Hi, Carol McKinney from the California Supported Living Network, and I ditto what Jackie was just saying. The point that I would like to make is we have had conversations with Department of Labor over this, and they made it very clear to us that we are in a joint employment relationship with in-home support services. The other thing that I wanted to mention is with regard to the funding of this, if the appeal is upheld by even though there is money in the budget for this, it's only 5.82%, and so conversations need to be had regarding that because, as Tom said, that's not even half of what costs will be. So thank you.
Thank you. Next witness, please.
Evelyn Abu Hassan with Disability Rights California. We just want to make a few comments. To the extent that the IHSS proposal moves forward and hours are capped, from a consumer perspective, we really think it's important that there's an exception process in place for individuals that need more than the capped hours. Secondarily, as Tom said, we think it's really important to really address this interplay between SLS and IHSS so consumers can get what they need. Thank you.
Thank you. Next witness, please.
She doesn't want to. Marty Emoto, California Disability Senior Community Action Network. I'm also a family member. Ditto the remarks previously made. Also want to add on the point that was raised in the committee agenda, asking whether or not the state or DDS could carve out or provide home care services to people with developmental disabilities who are eligible for regional center services so they don't have to go to IHSS. We think that is something that should be pursued and maybe have the department be directed to bring together stakeholders to look at that and present a plan back to the legislature. And we think that if that's implemented, that could address some of the concerns raised regarding joint employer relationships. But larger than that, it actually would improve quality of care. Thank you.
Thank you. Next witness.
Hi, my name's Patty Dixon. I work in HR and have done so for about 10 years in a supported living agency. It's very clear that we are a joint employer with IHSS in this situation. When we assist clients to hire staff, terminate staff, schedule staff, we are, in fact, joint employers. All the legal advice has told us so. So that is, I just wanted to affirm that that is the case. Thank you.
Thank you. Next witness.
Good afternoon. I'm Stacy Sisson. I'm with Strategies to Empower People here in Sacramento. And I wanted to ditto Carol McKinney and Jackie Dillard-Foss's sentiments and also Jackie's frustration and passion because she's exactly right. We've talked to the Department of Labor ad nauseum for the last year. We've spoken to employment labor attorneys ad nauseum over the last year, and we are absolutely 100%, without a doubt, in a joint employment relationship with IHSS. As far as not considering having supported living agencies be responsible 100% for paying rather than having an IHSS/supported living agency, it needs to be done. Most of the money comes from the 1915C waiver anyway. It goes into the same pot. Why separate it out? Why have to make people wait for their paychecks from IHSS? It's ridiculous. Something has to be done. Thank you.
Thank you. Next witness.
Thank you. Good afternoon. My name is Ruthie Goldkorn. I'm representing Californians for Disability Rights, and for identification purposes, I'm also the chair of the Disabilities Caucus. We can't take a position because we haven't met yet, but I'm sure that we will after the convention. And Californians for Disability Rights is on record on these issues, and long-standing, and the economic value of providing supportive living services and IHSS services versus institutionalization is well documented. And again, I absolutely concur. The conversations have been ad nauseum, and the cost-benefit analysis has to fall on the benefit side, and trying to separate out, trying to decide who's what, who's who, only leaves the person with a disability in limbo and their providers not knowing when that paycheck is going to show up. Thank you very much.
Thank you.
Dan Hoag, Los Trompus in Lafayette. Ditto, 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 ditto. And also, in addition to that, there are certain agencies like ours where we provide more services than just SLS, and the wage orders don't necessarily match. Most SLS agencies fall under wage order 15. We end up falling under wage order 5. So the overtime rules then become very different for under wage order 5. And I think that there needs to be some kind of exception for personal attendance in all of the wage orders where we have consistency among supported living services, across the board, so that we are treated as equally as any other supported living services provider. Thank you.
Thank you very much. We're going to hold this item open pending May revise and perhaps the finalization of the court case. We'll now move on to developmental centers, issue 1. This is an informational item, page 5 of the agenda. It's the background and governor's budget overview. Mr. Doyle, you going to lead us off?
No,
or
Madam,
Mr. Wilkening, I'm sorry.
Actually, Madam Chair, I'm going to turn this issue over to Mr. Dwayne LaFawn.
Hi, Dwayne LaFawn with Developmental Centers Division of DDS.
And why don't we have all the other panelists who are going to be participating on this go ahead and come to the table, just to cut down on transition time before he gets started. And I'm going to ask the panelists to be diligent in terms of the time frame that was given to you by staff, please. It's a large panel. Thank you for making room, gentlemen. Mr. Wilkening.
Dwayne LaFawn, DDS. Thank you. We're just going to start with a brief overview of the proposed budget this year. If you note on page 5 in your agenda, we currently have 3 developmental centers open and 1 intermediate care community facility open as well. Lanterman Developmental Center is currently closed and in warm shutdown mode. And I just want to note, too, that the 3 centers that are open are licensed as hospitals and have distinct parts for nursing and intermediate care. And so a lot of the infrastructure and fixed costs you'll see are associated with the required hospital operations that go along with those licensed facilities. For this current year in 14-15, we are estimating an increase of $34.7 million over the enacted budget. Most of that, about 40%, is due $13.3 million to staffing adjustments with retirement and compensation that was negotiated through the collective bargaining agreement, 8.8 million as backfill for the 4 uncertified units at Sonoma Developmental Center, 0.5 million associated with the staffing adjustments for opening the 2 crisis centers, one at Sonoma and one at Fairview, 11.9 million to cover what we call the PIP positions, which are really staff adjustments for undelivered staff at Fairview and Porterville. And then, more importantly, a $9 million increase to expand beds within the secure treatment program at Porterville Developmental Center so that we can admit 32 additional individuals in that area. For budget year 15-16, there's an estimated decrease in 13 million total, with a 3.8 increase in general fund. 13.5 of that, again, is to continue the adjusted retirement and compensation through the collective bargaining process. 18 million of that is to continue the additional 32 beds at Porterville. 1.6 million for the Sonoma Creek Pump Station intake. 12.2 million to continue the staffing fill behind for Fairview and Porterville for their undelivered staff. There's a 17.3 million cost in there for pursuing open workers' compensation claims from closing Lanterman Developmental Center. 1.5 million for continued Lanterman post-closure transition and support. A $12 million decrease due to our anticipated population adjustment. We're losing 134 residents was our current projection. And then to close out the books on Lanterman, that would be a $64.8 million decrease. And that's the quick overview.
Finance, LAO, any comment on the overview? None? Again, this is informational, so there's no action that's required. Thank you very much for the overview. We'll move now to issue 2, Future of Development Centers. Again, oversight. I'd like to welcome our colleague, Senator McGuire, who's joining us for this section of the agenda. And I believe Senator Bell and others are watching the hearing via television. We've got a series of witnesses who've been invited to come and give their perspective on this very critical issue. Again, Mr. Wilkening, Undersecretary, Health and Human Services Agency, John Doyle, representing DDS, Sean Martin from the LAO's office, Supervisor Susan Gorin from the County of Sonoma, Kathleen Miller, President, Parent Hospital Association for Sonoma Development Center, Terry DeBell, President, CASH PCR, is there a way to say it? CASH PCR, thank you. Former Assembly Member Dion Aroner, partner with AJE Partners, Catherine Blakemore, Executive Director, Disability Rights California, and Jackie Foss, CEO, STEP Agency. We'll get started with the Undersecretary.
Madam Chair.
Senator.
Thank you, Madam Chair. Fellow colleagues, could I just make a few brief introductory remarks?
As brief as they can be. Thank you, sir.
Thank you. I just want to make a few comments before we start our discussion about the future of developmental centers. It's my belief that developmental centers are not fulfilling the Lanterman Act's vision of helping people maximize their potential in community settings. I think that the developmental centers need to close, and I see that the agenda today includes a lot of information about the same concerns that I have been articulating since I have come to Sacramento. I authored SB 639 on this topic, and many people here today probably know that last week we had a policy hearing in Senator McGuire's committee, and we had a very robust and a very valuable conversation there. And I appreciated the very deep and genuine concerns from people whose family members have lived at these developmental centers or live at the developmental centers. And I also appreciate Senator McGuire's concerns and partnership in crafting a solution to this problem that we're going to be addressing here today. SB 639 is now a 2-year bill so that we can continue to work on the best way to move forward. The developmental centers now cost more than $500,000 per person. And I think we need to spend our dollars in a more productive way. Specifically, I'm making sure that community services have enough funding to serve the consumers in the best way possible. I'm also very concerned about the loss of federal certification for the developmental centers and the loss of federal funds that we'll be talking about later today in the way of backfilling. However, closure needs to happen in a very careful and thoughtful way. That was articulated very well during the hearing with Senator McGuire's committee. And we need to make sure that each resident has an appropriate place in the community before a developmental center closes. My intent has never been to pull the carpet out from anyone, especially those with severe developmental disabilities. We also need to make sure that local communities surrounding the centers are heavily involved in the planning, the future use of these properties. And it's my hope that there is a way to meet local goals while still using these properties to generate new revenue for our community centers and community services. I'm glad that this Budget Committee is taking the time to explore these issues in depth today, and I hope that we will continue to be able to work productively together to frame plans for completing the shift from developmental centers to community services. And I feel very honored to serve with my distinguished colleagues, including Senator McGuire, who's here today.
Thank you, Senator Stone. I think the point of us putting together a very diverse panel today was to inform us all about some of the critical issues you've raised, and I hope that we all keep an open mind as we hear from the panel of experts who are going to be here to share their perspective. Would you like to provide opening remarks? Thank you very much. Appreciate that.